So this client here flew in from Reno. Why don't you just talk briefly, like a minute long, about the problems you're having?
So I, 5 years, 5 surgeries. Started with the labrum tear, labrum revision surgery, and then multiple adductor releases, and no help whatsoever.
Whatever you do, if you're in this situation, do not get the surgery. Call me and I'll fix you. And I'll make a bet that in 2 or 3 months from now, I can get this guy fixed with all these problems he had for 5 years. He never needed surgery, and I'm going to show you how many imbalances he has today and what is causing the issue. Remember, I'm not just the shoulder guy here. This is also my specialty is hips. No one's had worse hips than me, and we're going to do some videos on me and what I went through and what I'm going through now with my hips. All right. So first exercise we're going to do is we're going to do the glute fly. We're going to start with that. So let's do that now. His heels right on the edge of his hips here. Okay. And now go ahead in and so he's going to bend. He's going to touch the top of his Achilles. And now look at, and then he's going to take this foot. He's going to touch the heel, touch it down. Your knee. I just want them to see this. And now go ahead, lift up, put the pad, everything. Good. Put the weight on. And then good. And now good. Before you lift, get the hip, slide the knee. Okay, that's a nice position. We want to try to start with our hips at this angle. So if I'm square here, look, he's almost that far ahead. Okay, like 4 inches. Some people you got to start back a little bit because they don't have the range. Go ahead and lift and just show what you're doing. Go ahead, move with it. Go ahead, up and down. Notice how when he comes up, go ahead, that this is moving forward and backward. See how his hips kind of just slightly moving this way on the way up. So what I want him to do is come down, do not let this move at all, and just lift a tiny bit. That's where he can maintain his shape. Just hold, don't even move with it. Don't come, and look at how, just a tiny, he's not even a fist off. He's just like an inch off the floor. Can you feel that?
Yeah.
We're in dorsiflex. I don't even want him moving with it because he's got no range. But if he's gonna move with it, drop it down to the floor, and now up. Don't let that move backward. Yep. And if he comes too high, watch what happens. Go ahead, look at what happens ahead. Eventually, he's gonna try to get this all the way up. But if he does that right there, it's just gonna wanna rotate back, and he probably starts feeling the wrong muscles, correct? Yep. You don't feel it here anymore. Right on the middle side of the butt right here. In this half moon shape. So I'm just gonna have him learn to hold for like a week or two and just really understand this position. And then I'll have him start moving with it, and then he'll start trying to lift higher. But for the first like month, I literally, if someone's this bad, I just have him go a fist and master a fist to here for a month. I don't even have him lift any higher than that. Just build the connection to glute. Then we can start going up in weight, and then we can start lifting. Okay, let's do the other side. Okay, now we're gonna do the left side. Same thing. Get his heels right in line with the front. Go ahead. Touch the top of the Achilles. It's a little too high up. There. Good. Foot there. Pad. Touch your knee down on the floor. Establish the hip angle. And now he kind of struggles on this side. I'm going to show you why. Go ahead and lift up. Good. Just hold. Hold. Then don't move with it. Just hold. Hold where this doesn't move at all. And you're kind of feeling it here, right? You're not feeling it so much in the glute,
Yeah,
correct?
Correct.
And it kind of shoots into the hip flexor a little bit.
Mm-hmm.
So on this side, go ahead and take a break. On this side, it's an adductor weakness, believe it or not. And if I get the adductor firing up with the single leg, and we have all these things in the apps, just make sure like a website app. It's the programs are on our website. The app's on our website. You don't get it through the app store. That way I can make more money off of it and they're not going to take a percentage. Alright, so let's go to the wall. Forget this. Now what's going to happen is I'm going to fire his adductor chain up on his left side. Generally, if you're right-handed, you're always going to lead with your left leg forward. So you're pushing off with your right. That pushing in your sport, okay, if I swing, push, develops the adductor chain. This side develops more of the glute max and the upper part of your medius up here, okay? And it gets very underdeveloped in the inner groin. So now what we're going to do is we're going to put them here. Now if I start them up high, I'm going to start them high here. And just squeeze for like 10 reps. And tell me if it pinches here or if you feel it. He wants to feel everything here, not pinch. More pinching. So it's pinching. So if it's pinching, what I'm going to do is I take this leg, bring this down too. I'm going to bring this down lower here, and I'm going to put this foot right in the center line of his body. If you get right over top of here, babe, you see how the foot, this heel is right in the center of the body. I'm going to bring it down. And now, I want him to feel the strip from here to here. Can you feel that now?
Yep, yep.
And watch again. If I move this up, squeeze, what happens to the chain? And then it goes there. Yep. His goal is to get it up here, but he's got to start where he connects into the weakness here. That's what's causing his disconnection to the glute on the floor over here. So if I can get all these muscles working properly, he's at the base level with this exercise. He's at the base level with this. Then his FAI symptoms, just his general hip problems he's had for the last, what, 5 years?
Mm-hmm.
All of it's going to go away. And no one believes me, but I'll make a bet in 2 or 3 months from now, he's going to be at the point where he's not going to believe it. And all this stuff's going to go away. Because I've seen it happen with multiple athletes with very similar issues to him. And the worst thing that you can do is if you have FAI or labrum tears, the worst thing you do is get surgery. All I've seen is more problems from that. You just have to correct these imbalances, and then you don't need the surgery. And now we're coming back to this. And I guarantee what will happen is, because we get the adductor chain, and I did 3 sets of that one over there. I really got it to fire and burn and him to feel that. Go ahead and lift. Don't lift so high, just lift where you're in control. I want it low. Everything low when the client starts, because if it goes too high, then the chance of compensation sits in. Just hold it. Hold, push your chest forward. Yeah, I want a little arch in your back. That looks perfect. And that should turn on now. Yeah?
Yep.
Good. And on this side, he's a little bit too turned down. I want him right there. Feel?
Yep. Can you use the post?
Well, this is different because it's at an angle.
That's right.
Okay? Well, you'll have a video now that you can see.
Yep.
On this side, just have a feeling that you're rolling back. Okay? Right. On the other side, you got to push down. Yep. But when you roll back, keep it back on the way down. That's the key.
Ooh, yeah.
Feel?
Yep.
There. So this is a mistake. You're overturned. You feel?
Yep.
Feel the difference. Go ahead. You
see? I don't feel it at all.
And then here, with your chest. There. Now go. There. You feel the difference?
Yep.
So on the way down, don't let that roll forward.
Okay.
I can do this. Like, I help people like him through video call. You don't have to fly in. As long as you got the camera set up properly, I can see these angles, and I just tell you, shift back. It's a little bit more work, but the job still gets done. Feel?
Yep.
Now, why does his hip rotate farther down this way? Why does it want to? On the other side, let's switch back to the other side. On the other side, it's going to be the opposite. He's going to have to really push it down. Why? Here, it's simple, look. If I'm a right-handed athlete and I lead with my left leg forward, let's say I golf this way, I'm constantly rotating into my left hip. It constantly wants to turn down. You have more hip rotation on the left side because of that. And on the right side, you're never rotating it in this way. And so that's why, look, on this side, he wants to roll back. On the other side, he wants to roll down. So you have to keep that in mind. So on this side, you got to really stay and dorsiflex it. If you don't, watch the intensity if you dorsiflex. Don't dorsiflex. Yeah, dorsiflex, correct?
Correct.
See? More intensity with the dorsiflexion. Why? I don't know. Just what I felt in my own body when I was trying to master this exercise myself. And I invented this because I have a bone-on-bone right hip. That's how I invented all these exercises, because I didn't want to get surgery, and I got myself out of pain. I was able to run, jump, lift with a bone-on-bone freaking hip. In my early 40s is where I discovered all these exercises, figured it all out, got an anatomy program, and really tried to feel where the muscle is that's weak. And that's how I really discovered all this. So someone like this, you got bone-on-bone hip, totally different ball game. But if you can fix yourself with a bone-on-bone hip, when I say fix yourself, if you can run, jump, lift without pain, like I did, then this is easy to fix, because he doesn't have the same issues that I have. You don't have bone-on-bone hip, right?
No.
You just have labrum tears.
Yeah.
But guess what? If he doesn't get this fixed, he's going to have a bone-on-bone hip, because when the labrum gets destroyed, or the muscles aren't functioning properly, the cartilage is going to break down, and that's what's going to happen to him. No matter how many surgeries he got, it's just going to keep getting worn down. On this here, I'm going to have him start real close to get in position. His knee, ankle, and then what I'm going to do is I'm going to have him move a fist and a half away. So go ahead, move a fist and a half away. Good. And then touch your knee to your other knee. Good. That's good positioning. Go ahead. So see how the heel ends up being in line with the back of the butt. And if he grabs, go ahead. Just put the weight down.
Yep.
See how he can grab there? That means he's in good position. Now, put the weight on. I'm going to show you a little trick too that I've developed. And again, if you have a spouse or something, you can hold a pole here. I want this completely straight up and down. So when he drops it, go ahead, up and down. I don't want him coming off the pole. Show him what the mistake you were making. See how he rolls forward, and then now, exactly, now stay on the pole. So that straight up and down. Your hips are just completely still and straight up and down. That's the key to this exercise. You want to feel it in the same spot here, but it's going to feel deeper underneath, because we're really attacking the internal rotation, so that minimus is going to turn on a lot more on this. You feel it?
Yep.
I don't want him coming too high with his knee right now, because he just disconnected. Stay plumb. There you go. So that's, eventually you want to get to the top of the bench and be able to come down to the knee. Feel?
Yeah.
Crushing it? Yeah, it's getting killed. And you tried to do this on your own, and what happened?
I wasn't feeling it.
So he tried to do it on his own, he didn't feel it, he tried to do the ab exercises, he even had a trainer look at the exercise. If you really want to learn it and you're using the app, you got to really film yourself, then look at me, film yourself, look at me. That's the discipline you have to have. You can figure it out through the app if you really, really spend the time and do that. Most people aren't going to take that time. They're going to watch the video and then they're going to go and try to go into the position, and they're not going to really look at themselves like they should, because it's annoying. Or you can just hire me and I can teach you how to do it in 1 or 2 sessions, and then watch you every other week, and then I can say, okay, you're doing this, now you're ready for this. Much easier to learn. It's very hard to learn the system, just watching a video. Okay, got it?
Got it.
Let's do the other side. Let's see if he can get in position without me. He's going to slide in here. He's going to touch his knee, but look, get that ankle. There. Not bad. Good. And now just come off there like a fist and a half. A little bit farther. That's perfect. Good. Look at that. See how that foot's right behind him? Good. And if you grab here, doable. Good. You're ready. I'm going to plumb this here. Now, on this side, watch what happens on this side. Do you see how easy that is? You want to turn down and now go up and down. Just watch it, you feel nothing.
Yeah.
Now, I'm going to keep him back. Don't worry if you don't touch the knee completely either. Go ahead. Feel?
Yes.
So when we tried this before and his groin wasn't working, he couldn't feel anything. And as soon as I got the groin fired up, I had him do this one again. We did actually extra sets. You didn't see it. And now it's working perfectly, correct? Feel it all in the glute.
Yep.
Don't lose that on the pole. Don't lose that tension. There, don't worry about touch. And babe, if you get over here, notice how he's not touching on this side. See his knee just stays a little bit apart, that's fine. That's where he connects. On this side, he actually can come up a little higher and then he doesn't come down as low. On the other side, he's better off going down lower and not coming up as high. And it's where he's feeling it the most, that's all that matters. It's crushing it. 5 pounds. Now guess what on this exercise? The goal is he's got to take the knee up to here, touch the other knee, and he's got to build up to 10 to 15 pounds on this. Okay? And he's at 5. It's going to take him like a solid 6 to 8 weeks, and then he'll have this pass. And I have a whole other exercise that he moves on to once he passes, because why am I going to waste my time? His glutes working properly, now we need to do another glute exercise to get in deeper, to change the tissue more. So those are the key, those first 3 exercises. The glute fly, it's called. The one against the wall for the groin, and this one. Those are the main things that are going to create the foundation to fix his hip. Then we'll have more advanced exercises he's going to move on to take him to even another level where he's completely out of pain. He doesn't have to worry when he's lifting, running, jumping, skiing. But the other thing is that he's concerned about is talk about you've been lifting, right? Just kind of working through the pain.
Yeah, I get to the point all the time where I try something new. I say, forget it. I just want to stay in shape. I'm going to hurt anyway, so I just keep lifting.
So he's good, right? So it's just like so I told him, like, shut down your lifting for 2 months. Let me fix you. Then you're going to go back to the lifting. But what's cool about our program is we're going to go on and we're going to do hamstrings now. So I have a specific hamstring for him that you can see in the app. We're also going to do a quad exercise as well. So he's going to have 5 exercises that are kind of he's got his key ones that are going to fix him, and he's got some ones that are just going to maintain some of his strength. And then once he passes my test in phase 1, he's on to phase 2. This is all in phase 1, just 5 exercises for the hips. That's when I'm going to introduce back some lifting exercises, get his confidence back, and we're going to move on to more of the advancements. So that's it for today.